Heart health is about much more than that amazing muscle in the middle of your chest. It's about making sure the rest of your body is doing everything it can to support your entire cardiovascular system. Stroke is a cardiovascular accident in the brain. It occurs when a cerebral blood vessel is suddenly blocked or ruptured, and its impact can be devastating, if not fatal. But today at Riverside Methodist Hospital, doctors are testing an exciting new device that shows great potential for preserving brain function and saving lives. Chris Weber has more.
Rose Fortunato is doing quite well, considering she suffered a potentially catastrophic stroke just a few short weeks ago.
He said to me, "Are you having a hard time breathing?" And when I answered him, it sounded like a foreign language. He couldn't understand one word I said. So he called 911, called a squad, and they came immediately.
Fortunately for Rose, the squad brought her here to Riverside, which happens to be one of just 20 medical centers around the country participating in an FDA trial of a new device. For stroke patients whose symptoms exceed the 3-hour window for the safe use of clot-busting medicine, the new device gives doctors a window of potentially up to 8 hours and a minimally invasive way to get up inside the brain, grab the clot, and remove it intact from the body. Here's how it works. From a small incision in the groin, doctors advance a balloon catheter through the body to the carotid artery in the neck. From there, a microcatheter is advanced to the brain just beyond the offending clot. The guide wire is retracted, and a special wire emerges that assumes a corkscrew shape, grabs onto the clot, and gently pulls it back toward the carotid artery, where it's captured in the balloon catheter and suctioned out of the body.
With that type of device, our hope is that we can actually retrieve the clot completely out, potentially in one piece, and restore flow completely. In some patients, we've actually had complete recovery where they've actually gotten very much better from a very devastating stroke that was in progress.
For Rose Fortunato, recovery was both swift and dramatic.
I said to my husband, "What am I doing here?" And he said, "You had a stroke." And I couldn't believe it because everything seemed fine. Dr. Budzik came up the next morning and showed me a picture of the clot, and it was a pretty big clot. It was blocking the whole artery. Fortunato means very fortunate, and I guess I was.
Both Rose Fortunato and Dr. Budzik hope the clot-retrieving device is ultimately approved by the FDA. Dr. Budzik says preliminary results from the patients he's treated with it are encouraging.